Young-Onset and Juvenile Parkinson's Disease, The Paradigm Shift Effects. Written by Cara Warren. Class, Social Implications of Medical Issues. Instructor, Laura Schultz. And date, October 17th, 2014. Usually, Parkinson's disease starts in patients between the ages of 50 and 60. When individuals are diagnosed with Parkinson's disease before the age of 50, the disorder is referred to as young-onset Parkinson's disease, which only makes up about 10% of the documented cases. When motor symptoms appear in patients younger than 20, this disorder is referred to as juvenile Parkinsonism. I feel that children dealing with what is usually referred to as an old person's disease are especially vulnerable not only to the disease itself, but to the social stigmas and issues associated with a neurological disorder such as juvenile onset. Early onset PD patients may experience more social and psychosocial conflict compared with late onset patients, and these factors would contribute to greater impairment of quality of life. We now know that genetics does play a key in young onset and juvenile Parkinson's, which is viewed as a separate disorder by the National Parkinson's Foundation. Since Parkinson's is still greatly overlooked in young patients, those with young onset or juvenile PD is probably much higher than the estimated 10% diagnosed. Being able to genetically determine these diseases gives caregivers the chance to use preventive measures in patients not yet showing any signs of physical or mental deterioration. The person and environment perspective allows us to take in all factors that play a role in the mental and physical health of our patients. This approach is often used by social workers and care providers to help treat the patients as a whole by 1. Viewing the interactions and relationships with the person's environment. 2. Assessing all biological factors, both family history and genetics. 3. Assessing all environmental factors, mental health, emotional health, physical health, spiritual need, as well as current and past environments. 3. Facilitating access to health services. 4. Facilitating access to mental health services. 5. Use all variables relative to treating the whole individual. 6. Allowing an individual with chronic illness to live as full and comfortable a life as possible. The biopsychosocial model transformed the physician-patient interaction into a dynamic system in which the individual patient's perception would be fully integrated into the process of disease management. Overlaying factors affecting mental health. 1. Biological, physical health, disability, genetic vulnerabilities. 2. Social factors such as peers, family circumstances, and school interactions. 3. Psychological, the individual's self-esteem, coping skills, and social skills. Overlapping biosocial factors would be drug effects. Overlapping psychosocial factors would be family relationships and trauma. Overlapping biopsychology effects would be IQ and temperament. Bronfenberg's ecological model of the environment perspective and areas of focus further shows how patients are affected by their environment. 1. By the microsystem, family, classroom, religious setting, and peer groups. 2. The mesosystem, interactions and communications between the microsystems. 3. The exosystem, the community, the school, the medical institutions. 4. The macrosystem, cultural values, social conditions, political philosophies, and economic standing. The ecology model shows that patients and their chronic conditions are greatly affected by the environment at all levels of the ecological model. Although young patients with PD have a slower rate of progression and a low rate of dementia, they have increased rates of both dystonia and dyskinesia. These are side effects of treatments rather than signs of the disease itself. Although these medications help treat the disease, they can also undermine attempts to communicate with others and interfere with peer interactions. It is important for caregivers to take in all relevant factors when creating a treatment program for patients and their families. This includes evaluating family needs, peer relationships, school interactions, and seeing how well educated about disabilities those around the patients with PD are. Luckily, there are organizations such as A Touch of Understanding, whose sole purpose is to educate children and adults about disabilities. By helping children address their fears and concerns about disabled children, they are helping eliminate the social stereotypes and other issues as well, especially for young children with PD whose psychological burden is heavier than those suffering the same chronic condition. Psychological support at the micro, meso, and macro levels are going to be extremely important for the child's quality of life, both mentally and physically. Making a difference in these children's life include environmental evaluation, community support, medical treatment, physical therapy, using all variables to treat the whole individual, educating the public, and supporting the family.